Good morning, everyone, and welcome to the Sanlam Umbrella Fund Health Overview session. Thank you all for your time. I hope you find the next hour or so will be highly informative and exciting for you to take through to your clients over the next few months. So maybe before we get into the meat of the presentation, some guidelines for the actual webinar. So your microphones and cameras, unfortunately, have been disabled. So any questions that you need to pose, if you could please put those through the Q&A button, and then someone will monitor those questions and we're able to respond to you during the course of the actual presentations. We will be recording the webinar, and this will be made available to you post the event. So what is it that we're here really to talk to you about? I think Sanlam's vision as it relates to its corporate solutions suite of products is to bring to the market, for those clients that want that and for those intermediaries and consultants who support that idea, an integrated health and employee benefits proposition. It's quite clear from the market research that we do every year as part of our benchmark studies that there is a growing segment of the market at this stage, maybe over 50% of the employer groups, who would actually welcome solutions that integrate employee benefits and health. This is our second health integration initiative within our umbrella fund, the first being the virtual consult offering that many of you are potentially aware of already. What we've done now as our second iteration of integrating health into our umbrella fund is we've looked at the umbrella fund and we've looked at our group risk base, and we posed the question to ourselves, what sort of price point would we be able to get, and what sort of benefit structure would we be able to put together from a health perspective if we use the whole of the Sanlam Umbrella Fund and the Sanlam Group Risk member base as our risk pool. Obviously, with that degree of scale, that would be over 1 million members, we felt we were able to get much more aggressive price points across 3 key product categories that are very relevant from a health perspective in the market. The first being private primary healthcare. So this is offering members access to doctors and nurses, primary care type services. Second would be employee assistance programs, which, as you know, are very common in the market. And third would be the traditional gap sort of products that I think many of us who are on medical aids would be aware of. So the content that we'll share with you today is the benefit structure for these products, the price points that we put together, and we're very cognizant that many people on the call won't necessarily be health accredited. So we will share with you how we as Sanlam can help you and your businesses present this material through to your clients if you are not in fact health accredited. Maybe the last point before I hand over to my colleague Kerry to walk you through the staff care offering is this subset of health offerings is probably about 25% of what the holistic Sanlam health solution offering is. So we would also welcome the opportunity into the future to share with you what we're doing more holistically around health, share with you our primary health insurance products, our partnerships with FedHealth and Bonitas, and some of the interesting health integration opportunities that we have available for you in turn to take through to your clients. So hopefully you'll find it an exciting and invigorating 40 minutes, 45 minutes. We're certainly excited to share it with you. With that, I'll hand over to my colleague, Kerry Herzog, to take you through the Sanlam staff care offering. Thank you. Kerry?
Thank you very much, Gary. I appreciate the introduction, and most importantly, also your support. Gary has driven very, very hard to get the service providers that are presenting to you today to drop prices so that he can achieve what he's just described in enabling us to present you with a very, very cost-effective solution that addresses a number of the areas that employers have massive concerns about. So specifically, I'm talking about the Sanlam staff care. product, and this is offered exclusively to the Umbrella Fund, Unity and SGR participating employers. It's not going to be allowed to be offered to somebody who doesn't belong to this segment of Sanlam's book. If you are targeting a client and trying to bring them over, this can be used as a sweetener, but would not be able to be sold to them at a standalone space. We've, as I said, we've got preferential rates that we've negotiated on behalf of the Sanlam Umbrella Fund customer base. And what we're trying to achieve is offering healthcare, access to private healthcare at a significantly lower rate than what you would see in the market. But without our intermediaries, it would be difficult to get it into the market. So you would receive an ongoing 15% of the total invoiced amount. I'm avoiding referring to commission because this is not an underwritten product. This is a managed care product where the managed care organization is paying service providers directly. And therefore, it isn't a commission, but it would be equal to 15% of the ongoing amount each month. The benefits that are available is through Sanlam Staff Care. That's quite simply, we are at price point of 20 Rand per employee. We would allow employees access to telephonic consultations, nurse visits, and doctor's visits. Telephonic consultations, we've got data to show us that between 50 to 60% of all health concerns, my child's sick, I'm not feeling well, I've cut my finger, I've got an eye infection, between 50 to 60% of health issues can actually be resolved telephonically. When I say telephonically, I'm not referring to virtual. We have to differentiate between that. We're talking about a WhatsApp call where people are either messaging or they're on the phone speaking to a qualified nurse or paramedic, going through their concerns. And at that point, the paramedic or nurse would be triaging according to they've got healthcare systems that would help them triage, and following very strict protocols and guidelines with regards to when they actually say, you've got a problem and you need to see a physical GP or nurse to assist you. Up until that point, they're trying to assist telephonically. Trauma and bereavement counseling, very often people's anxiety, inability to eat, problems sleeping, nausea, ongoing headaches has got a lot to do with anxiety, and we've got nurses that are available to go through their concerns and help them with stress and sort of anxiety relief techniques. Young moms going to a doctor and getting a diagnosis but being too afraid to ask what they mean. All of this can be done telephonically. But as I mentioned, if it gets to a point where the nurse feels that the person that they're speaking to, the employee, needs to see a doctor, she would then issue a pre-authorization to either a nurse or a doctor. So included in the 20 Rand per member per month fee, we would cover up to 5 visits to a pharmacy clinic nurse in a 12-month period. A nurse would be able to examine, a nurse can basically do everything except script chronic and above Schedule 3. So they would be able to look at a wound. They would be able to take somebody's temperature, blood pressure. If it gets to a point where a nurse or a GP needs to refer the member to either have blood tests or x-rays or take certain meds, those costs, unfortunately, will have to be covered by the employee. But at the same time, keep in mind, at least they know where they are, what the issue is. And if they do need to seek further treatment past a doctor's visit, and they would need to potentially have x-rays done or blood tests done that they can't afford, they would then have to fall into the national health, into your healthcare system, the government provided healthcare system, that is, and they would potentially cover those costs themselves or go through state to cover those costs. With the GP visit, we're covering 3 GP visits in a 12-month period. And similarly, we aren't covering the cost of medication and consumables. So going back to recap, for 20 Rand per employee per month, available to groups that are part of SGR, Sanlam Group Risk, Sanlam Umbrella Fund, and they would have to have it on a compulsory basis. So we wouldn't be able to just do the members that wanted it. It would have to be covered on a compulsory basis on a group and at 20 Rand, and you as the intermediary would earn an amount of equal to 15% of the commission. From this, I'm going to now introduce Dr. Shamila Faki, who's going to present on our employee assistance program. Thank you very much.
Thank you, Kerry. Good morning, and thank you everyone for joining this session today. I will be talking to you about the Sanlam Evolve Employee Assistance Program. So in recent years, the need for an EAP has escalated, with very high levels of depression and anxiety being seen globally at the moment. It is therefore necessary for us to equip our clients with the necessary tools to deal with psychosocial stresses in the workplace. Therefore, in collaboration with ICAS, we have co-created an affordable digital employee assistance program for Sanlam Umbrella Fund members. And through this, we would like to empower clients and their employees with the necessary tools and interventions to improve their well-being and productivity. So in terms of what we offer, the objectives of the Employee Assistance Program is to show or demonstrate a measurable return on investment. So that will be looking at the number of utilization as well as the changes in absenteeism and presenteeism patterns in the company. We will also want to position ourselves to deal with personal, professional, and other psychosocial concerns with that employee that may be impacting on their work performance, on their general health and wellness, as well as the company. And through that process, we are going to be creating the culture of care within the company. So helping and dealing and containing with psychosocial problems can help improve the general well-being and productivity of the company, as well as having, the downstream effects of better business performance. So in effect, we are helping that client to have better financial performance, hopefully. Through providing the social, psychological, cultural, economic, and trauma-related management and care, we do hope to reach out to the employees that are going through quite challenging and trying times in our country at the moment. So in terms of what sets us apart, through the ICAS partnership, ICAS is affiliated with a large international company, and therefore they have access to the best researchers, statisticians, and data analysts. We therefore use a very data-driven approach to help develop and provide guidance to our clients based on the evidence that's provided through the utilization statistics. Confidentiality, it's very important to us, and that will always be the hallmark of our Sanlam EAP. In terms of outcome assessments, we do believe it's important to apply a method of gauging where we are at the present time, as well as ongoing assessments to ensure that we are meeting the necessary outcomes and objectives in the company. And in this program, it's a proactive digital program. I will talk you through the detail of that, but it's all about managing our client through a digital or virtual team of client success managers that are equipped to deal with your clients on this virtual platform. So in terms of the support services, the first one is the employee support services. So the access for that employee would be, to professional and confidential counseling 24/7, 365, and that's through a telephonic support line as well as live text counseling. Filtering down from that, we are then able to provide the necessary support, whether it be financial coaching, whether that individual requires further assessments, or whether the manager needs to refer the employee on for further care or intervention. And we are able to identify stress drivers. For example, we've seen quite a high number of financial stress drivers in our clients at the moment, and we do believe that through this utilization program and early identification of stresses, we can be proactive in the number of campaigns that we provide in the L&D webinars that we issue, as well as the Wellness Hub portal, which we will demo at the end of this session. Just another note on the proactive employee campaigns. Some examples include Financial Fitness in 5, which is a monthly campaign that we can run with the employees, or digital or on a virtual platform. We can also have other campaigns such as mental health workshops, also, targeted, focused, with outcomes measured before and afterwards. So in addition to support to the employee, we also provide company support. And as I mentioned earlier, the virtual client team is able to provide the guidance based on utilization, looking at the statistics, and support the employer with providing the necessary intervention. We're also able to equip the custodian at the relevant company with the necessary guidance, the necessary tools, and that's all through our HR program portal. There they're able to access webinars as well, and it will all be based on the need at the time, but also based on, for example, the National Health Calendar, which we work closely towards or closely aligned with. We're also updating regularly the information so that we can provide you up-to-date and accurate advice and guidance. The other aspect that is also very much of a differentiator and very useful to the client is the online reporting dashboard. Through that, the client is able to access a dynamic reporting where they can see the number of utilization and the trends, and Gordon will just give you a brief snapshot of that a bit later. Once a year, we do an organizational wellness diagnosis whereby we are, through a quick survey, are able to identify where additional support may be required. And then furthermore, the marketing material in the library, all accessible to the HR portal, as well as the wellness campaign toolkits, which are all guided and designed so that the HR manager or custodian in the company is able to proactively manage the employees. In terms of accessing the program, there is the Wellness Hub, which we will take you through in a bit. And through the Wellness Hub, there's access to a whole host of information to help support the individual with psychosocial support. Also, the library of information with articles, videos, questionnaires, and the live chat support, which is an interactive way of dealing through to or being put through to the National Operations Centre, but also through text-based counselling that can be provided on this platform. Additional management support, and the reason I'm talking a lot about this is because it is a differentiator in that it's not just employee targeted, but we are concerned about the employer and the client outcomes. So in this sense, we are able to provide support with, for example, absenteeism, if there are issues at work with relationships or conflict, and if there are challenging employees that are just not able to meet their work requirements. Through the virtual manager referral, they are referred into the program, and our consultants are able to then support both manager and employee further. On the right, just an example of the dashboard, and we will go through that in a bit of detail now. So in terms of infrastructure, we have over 100 telephone technicians that are able to answer any calls and direct the employee to the necessary consultants for further counselling and advice. The service is available in 11 South African languages, and we are also able to, or employees are also able to access the service through USSD, email, online through the desktop, as well as through the app and live text-based counselling. So the beauty of this program is that we are able to create a flexible program for our clients in that you can have the basic digital program, which is primarily telephonic based, or additional services can be added on, such as face-to-face counseling, group trauma interventions. If the employer, for example, requires additional utilization reports in hard copy, we can provide that. And then further learning and development workshops in addition to the core that we are providing through the Wellness Hub. In terms of the cost offering, and we were asked to create a comparison with competitors, but it's difficult to compare this because we don't see any other program that can be compared like for like. However, at 15.82, I can assure you that it's quite a competitive rate. If you are looking at the SME market, traditional EAPs are more in the region of 30 to 40 Rand per member per month. So I think, yeah, at 15.82, we've managed to reach the price point for the target markets. So additional service fees, I've noted these down and I will be able to share this with you later. But for example, group trauma interventions, for those sessions, it's noted at 5,219. And then face-to-face interventions. Here we are talking about one, for example, the first line, it's one individual offsite face-to-face counseling. So that's access for one case to be managed. So if there's one employee that requires face-to-face counseling, it's not per session, it's to manage that case through face-to-face sessions, which may be unlimited depending on, or not unlimited, but more than 1, 2, 3, up to even 6 sessions that may be required to manage that case. And then learning and development rates, we've noted that as well. And then the monthly reports that I've referred to. I'm going to hand over to Gordon right now, but just before that, also we work with you and we work to get the client on board. So regularly reviews, which include quarterly sessions, will be set up where we are sitting down with the client, identifying trends and providing them with the necessary recommendations. Gordon, I'll hand over to you.
Thank you, Dr. Shamila. So, yeah, the big focus, what we want to present to you today is just to demonstrate to you 2 areas of the program. I mean, there's so many different elements to it, multiple pillars that we can support both the employee, manager, and organization. But like Dr. Shamila's mentioned, the hub will be the main focus, a main point for employees to engage with ICAS. Through this is the desktop version, but it is available again on their cell phones. What they'll have the ability to do is again dial their toll-free number or engage with a counsellor via text. What I wanted to demonstrate for you today is just an idea of just the level of support that they would be able to receive in the form of our videos. So if I had to click on about mood disorders, you'll be able to see there's a short video for employees or management to watch. And what I like about it is also the credentials of the expert that's doing the talk. It's really short, 2 to 5 minute videos, and then also a further summary on that. The beauty of the hub as well is the algorithms are really starting to focus around the employee that's trying to build their own wellness journey. So you'll start to see multiple articles are included every time somebody opens up their page, and they can start to create their own journey through wellness as well. From there, they'll be able to have all the access points to the different services that are available to them. So again, yeah, we know that financial services included. They'll be able to click on financial services, be able to speak to a financial coach. So that's available again through the chat. And these are some of the features. If we look at where we are at phase 1 of the hub, there's going to be new surveys included, always continuous uploading of new content as well. And what I wanted to demonstrate for you today is also just the ability to engage with a counsellor. So this is very much a key differentiator. A lot of the competitors will be providing not necessarily counselling support, but this would be more for setting up appointments with a counsellor and so forth. What happens in this instance is that you would engage with a counsellor immediately, and this again is not a robot. This is a real person that you would be engaging with. We've definitely seen a high uptake in trends. So what are the trends that we're seeing? We're definitely seeing that people are opening up a lot quicker. So instead of going through let's say a call and a triage of questions and answers, and then eventually the individual opens up, yeah, people are opening up a lot quicker. Yeah, you can see the counsellor is very quick to respond. So again, just demonstrating the service level. When we look at a call, our call answer rate is within 45 seconds, we will answer the call. But we know that if somebody's in a heightened emotional state, 45 seconds feels like a lifetime. I'm just going to let him or her know. Thank you. This is a demo. Okay. So we have seen cases or sort of a session last up to about the average being between 30 to 45 minutes. And again, this is available both on their cell phone and on the desktop portal. Keep in mind in this program that the support is available not just for the employee, but also for the family member as well, so the immediate family member. From here, I wanted to demonstrate also how do we support your client. So your HR the HR, what do you call it, business partner or your HR custodian, they will have access to this dashboard. This dashboard is updated every single month, and then people can access it 24/7. You'll see we measure 2 areas. We measure both engagement and utilization. Engagement is focusing on, like the hub, what articles are being read, what are the videos people are watching, how are they engaging with the program through attending webinars, which is, again, they have 2 webinars that they can attend every single month, really, again, with the focus on building a journey. From there, they'll be able to see the utilization of the program as well, identify what are the main services used. So if it's telephone counseling, financial assistance, how many referrals are being done virtually. This is, again, at their fingertips. They can also use the download functionality, so they can download the charts if management wants additional information. The next pillar to the dashboard is also they can see how many cases are currently open and what are the stress drivers within these cases that are currently open. So if we look at problems, you can see what the presenting problems. This is a test one, so this is a demo version. But what we'll do is, again, you'll be able to see what are the severe cases that are currently open, what are the stress drivers. Also, geographically, we can upload sites, so the employer can actually see where are the sites located that are having the most stress at that moment and how best we can support them. From there, we also measure the effectiveness, so the case is closed. This really puts the focus then on your ROI, where we demonstrate on how much money was saved in the form of productivity as we provided that professional containment and empathy in that moment of that employee. So again, with the focus on improving productivity and reducing absenteeism. And then the last pillar we also include is quality. So we're very transparent on that. If there's any compliments or complaints specifically from their employees, we'll be able to see that as well. And I see I've got maybe just an extra 10 seconds just to show you something which is very interesting. So we use the global functionality scale. So again, yeah, you can start to see if an employee has gone through an abortion or has an acute condition, what is the impact on productivity? This is the information that is now that invaluable information to your client to mitigate risk within the employee base. What we'll do proactively is every quarter engage with you, provide you with a report that you can present to your client, and then obviously help them, like I said, mitigate the risk. And that's it from our side. Dr. Shamila, back over to you.
Thank you, Gordon. I'm going to hand over to Samantha.
Thank you, Dr. Shamila. Thank you, Gordon. For those of you that don't know me, my name is Samantha Drake, and I'm the Head of Sales and Marketing for Sanlam Gap. I may take a bit longer than the others, but please bear with me as I go through our Sanlam Gap offering. You're also most welcome to ask any questions in the chat box below. Great, thanks so much. So what is gap cover? For those of you that don't know what gap cover is, it's a short-term insurance product for members who belong to a registered medical aid scheme in South Africa. And it provides members with an extra layer of cover for various specialist tariff shortfalls during an in-hospital or day procedure where your medical aid has funded a portion from risk. This also includes cover for additional benefits and which I'll touch on a bit later. Actually, I must just pause. Anna did send me a message. She just wants you to be aware that the 2 offerings just before spoken about with Kerry and Dr. Shamila, that this is taken up by the employer, whereas the gap, which is what I'm going to be going through now, is for the individual member take-up. We do have preferred group premiums as well, but I'll touch on that. But most of the presentation is around the retail client, so the individual member on gap cover. Sorry, I just want to continue here. So a broker is required to be accredited for personal lines in order to market the gap offering. Should you not have a short-term license, we are working on a referral model through Tender Health for the Sanlam Umbrella Fund members. Sanlam Gap for 2023 has 2 product options. It's our traditional comprehensive option, and we also have introduced a new core option, which is only available to our preferred partners, such as Sanlam Umbrella Fund, as well as the Bonitas and Fed Health medical aid schemes. However, for the Sanlam Umbrella Fund, the members under the Sanlam Umbrella Fund, it's fully compatible with all medical schemes in the industry. That's for the core and the comprehensive. So let me just briefly take you through the benefits on the comprehensive option. All benefits on Gap are covered from an overall statutory limit of R185,837 per person per year. Hospital tariff shortfalls, just note here that they covered at an additional 5 times or 500% over and above the medical scheme rate for procedures both in and out of hospital. Co-payments and deductibles, this will be covered for all diagnostic procedures, both in and out of hospital. And this cover is unlimited up to the overall annual limit for procedures such as MRI, CT scans, scopes. So any defined diagnostic co-payment on your medical aid scheme. This also includes, of course, wisdom teeth extraction. 2 penalty co-payments. So this is quite, if you look at our other competitors in the markets, this is probably the best benefit that you will get under Gap cover. In fact, we are exceptional if I look at the comparisons, which I'll show you later on in the presentation. But we offer 2 penalty co-payments up to 17,500 Rand each, or a percentage penalty co-payment of up to 30% when a member voluntarily uses a hospital that is not part of their hospital network on their medical aid scheme. We also cover hospital tariff shortfalls for sublimits such as your prosthesis. And on the comprehensive option, this pays out of up to 60,900 Rand per event. In an unfortunate event, such as cancer diagnosis, oncology tariff shortfalls, sublimit cover, and the charged 20% co-payment once your limit is exhausted on your medical aid will be covered in full, subject to the overall annual limit. We also cover biologicals, and this is obviously if the option that you're on your medical aid has cover for biologicals, otherwise known as innovative medicines. And we've got this cover of up to 25% or 13,000, whichever is less. Finally, under the core benefits from the comprehensive plan, our dental reconstruction surgery, which is benefit paid out as a result of accidental harm or oncology treatment that has occurred after the policy commenced. This benefit covers 2 events, up to 49,900 Rand less the amount paid by your medical scheme. If you look at the right-hand side of that column, you will see there are additional benefits. So we offer additional benefits over and above the core offering, and they actually don't form part of the overall annual limit of 185,837 Rand per insured person per year. I'm just going to start off with the accidental casualty benefit. This benefit is covered from casualty ward as a result of an accident, and we cover 17,400 Rand per event. So you can obviously go more than once during the course of the year of up to 17,400 Rand. This benefit actually is usually on your medical aid. It's usually covered out of your savings portion. So we'll reimburse the member here. Next is the casualty child illness benefits. And we did get quite a strong request for this. So this is not as a result of an accidental harm. This is if a child is ill. It's for children under the age of 12. For example, a high fever. And this benefit is covered up to 2 events per year of 2,700 Rand per event. In the event of premature birth, the family booster also provides a lump sum payment of 15,900 Rand. Along with the family booster or premature birth, and also as a result of an accident. So if somebody in your family is hospitalized as a result of an accident, we also have a hospital booster benefit, and this pays out per day. So it is from 480 Rand per day from day 1 to 13, 860 Rand from day 14 to 20, and 1,700 Rand per day from the 21st to the 30th day. So we don't exceed after the 30th day, and we pay a maximum of 29,300 Rand. Moving on to our family protector benefits, this is also a lump sum benefit that's paid out upon death or permanent disability due to accidental harm. For children below the age of 6, a 20,000 rand lump sum, and for every other insured party, 30,000. Medical scheme and gap premium waiver benefit also provides a lump sum upon the death or permanent disability of the policyholder due to accidental harm, where the policyholder is the principal member of the medical aid scheme. And this is to a lump sum of 35,500 rand. So it obviously is including your medical scheme contribution of that time, as well as your gap premium. And our last additional benefits for the comprehensive plan is the road accident fund, which is merely an assistance benefit from our administrators for your members. So just to let you guys know that the Sanlam Umbrella Fund members are going to be receiving an 11% discount. That's a discount upon our normal retail premium for Sanlam Gap on the comprehensive option. So the premiums here start off at 222 Rand for a single or individual under the age of 60. And then anybody, if you've got more than one, it becomes a family premium. Under the age of 60 is 391 Rand. So as long as your members join before the age of 60, they will enjoy those preferable premiums. And when they turn 60, they'll continue to enjoy those premiums. So they don't then automatically bump up to the higher premium for members 60 and older, as long as they join before the age of 60. And I'll go through all those things there at the bottom as soon as I've covered the core option as well. I've actually also just included a claim example. People don't realize the relevance and the importance of gap cover. So just as an example, this is an actual claim that we had. This is wisdom teeth extraction, where the provider charged 8,600 Rand, and there was a co-payment from the medical aid scheme of 3,500. Of that 8,600, the medical aid scheme funded just over 2,000, and Gap paid that shortfall of 6,500, as well as the co-payment of 3,500. So essentially, we covered more than what the medical aid scheme paid. So just over 10,000 Rand there. Right, let me chat around our new comprehensive core offering that is available to the Sanlam Umbrella Fund members and also to the Bonitas and Fed Health members as well. I do believe it's still very rich in benefits. So of course, everything comes from the overall annual limit of 185,837 Rand. Obviously, this is a statutory overall annual limit. And where the comprehensive covered at an additional 5 times. So let's say, for example, you were on a medical aid option that covers you at 100% of the medical aid rate. Essentially 600% would be covered. But here, essentially 400% would be covered if we include your option of 100%. It would be more than that, of course, if you had an option of 200% cover. So it's the additional over and above 3 times. Co-payments and deductibles, also defined diagnostic, very similar to that of the comprehensive, but whereas the comprehensive is unlimited up to the overall annual limit, we have limited co-payments both in and out of hospital to 10,000 Rand per insured per policy per year. So that's per insured person on the policy. We also have included 1 penalty co-payment for the non-use of a network hospital to a maximum of 11,000 Rand per policy per year. Shortfalls from sublimits, that's your prosthesis shortfalls, which are mostly, and here we have limited it to 30,000, which should be more than sufficient as well, and that is per event. Oncology tariff shortfalls are covered at an additional 3 times, so you're 300% there. And we also cover the oncology co-payment once your oncology limit has been exhausted of 20%. And that is to a maximum of 30,000 per insured person per year. Here we go from the premiums are from as little as 184 Rand per month, which is incredibly good. And then just mentioning there as well on both options, financially dependent parents, just please note that are not covered under a family premium for under the age of 60 years. But a child dependent, we do include up until they reach the age of 27. And this is regardless of whether they're financially dependent on the principal member or not. So you could have a 26-year-old who is working, living in their own apartment, but they're still covered under your one Sanlam Gap policy, family policy there. We also allow for one family policy for a member to be on other medical aid options or plans, because we are aware that sometimes the parents might be on separate medical aid options. And then I just wanted to include a slide here to let you know that if the member is on Bonitas and Fed Health, over and above that, we also have an innovative seamless claims process through Afrotech, which will assist members when claiming. Moving on, we're also very, very proud, I must say, to announce that we have launched a new partnership solution with the Mediclinic Hospital Group. And this will be an additional solution should your client wish to take this over and above their Sanlam Gap option, comprehensive or core. As previously mentioned, our members are covered at a casualty event for children under casualty illness under the age of 12. With the Mediclinic extender benefits, we've extended the casualty illness to the whole family. So the benefit covers after hours emergency treatment for accidents as well as illness, and it comes from 2 events per year to a maximum of 2,500 Rand per event. We've also added a very nice benefit, the specialist benefit, which is only paid out upon the visit of a specialist, which is working out of a Mediclinic facility, who charges more than what the medical scheme will cover, and it pays out of up to 4,900 Rand per beneficiary per year. Having been an expectant mum myself, those of you that do know me know that I do like a private ward, or forced my husband. After all, I was giving him a baby. And here we've got the benefit of the Mediclinic extender, where we cover a shortfall for 1 event per beneficiary of up to 4,900 Rand. The medical scheme and gap cover have your members covered as well in the unfortunate event of a cancer diagnosis, where we will provide a lump sum benefit of 10,000 Rand upon the first diagnosis from stage 2 or higher. Also, this is completely a cashless experience. So the penalty co-payments is unlimited. So for those of you that are in Cape Town and you are not, let's say, Durbanville Mediclinic or Panorama Mediclinic is not on your network, and you go to that Mediclinic from day 1, it is unlimited with your penalty co-payments. It's also a totally cashless experience when you go through, as well as your cashless co-payments that are also unlimited as well. But they're up to, oh, sorry about that. The penalty co-payment I've just seen is up to a maximum of 16,500 Rand per event. But bearing in mind, we're going to utilize those benefits on the comprehensive and core. I say unlimited, and that's because I haven't come across a co-payment that is over and above 16,500 Rand for a penalty co-pay. And then, of course, your cashless co-payment on your for your defined diagnostics. Apologies. These are just the premiums. These are the additional premiums for Mediclinic extender. So for I'm tongue-tied, sorry. Mediclinic extender will cost a single member under the age of 60 an additional 43 Rand for the Sanlam Umbrella Fund, 80 Rand for individuals 60 and older, 98 Rand for families under the age of 60, and 166 Rand for families 60 and older. Just to briefly touch on our underwriting, if a member has no gap cover before, we will have a general 3-month general waiting period, as well as a 12 months for any pre-existing conditions. That's only pre-existing conditions where 12 months specific will occur. Otherwise, they have full cover. If the member has been on a previous gap offering for 12 months or longer without a break of 90 days, no waiting periods will apply. And Sanlam Gap also does not impose a waiting period on a list of conditions upon joining unless the member has a pre-existing condition. Sanlam Gap classifies a group of 20 or more policyholders for preferred premiums as well as underwriting. And you can send those demographics onto your dedicated broker consultant, which I will go through her details shortly. She will also be able to assist with any mailers or a WhatsApp video clip, which you're able to send on to your members. So to ensure that we provide you with service excellence, we have a dedicated broker consultant or intermediary consultant. Her name is Crescentia Seapole, And these are her mobile number as well as her email address. In saying that, you also have a dedicated service consultant, Arlen Jatsky, who's available for any queries upon an active policy, and he has an SLA or service level agreement of 48 hours. Should you have a group that joins Sanlam Gap, we will also provide them with a dedicated billing specialist, and that will also be able to assist them. And then on the commission side, you will see there on the Sanlam Gap premium, it's a 20% commission is structured in line with the demarcation regulations that are set out. And this is payable on a sliding scale. Here is the competitor analysis that I promised you earlier on in the presentation. I have done it because most of you may be also marketing the discovery, the momentum, and then if you are a medical aid broker, you will also probably be aware of the Stratum Gap offering as well as the TRA Gap offering. So I've done this on their comprehensive plans as well as our Sanlam Gap Comprehensive for SWIFT members. You'll see our premiums on the retail side come in at a very well, it's very well priced premium compared to the others. And then of course, you will see there with regards to the 2 penalty co-payments I mentioned, where we're very, very strong, as well as the shortfalls from sublimits. Otherwise, you're most welcome to get a copy of this if you'd like me to send this slide on as well. We'll go into more detail, please feel free to ask. And then just in closing, I just wanted to do a screenshot of the marketing material that we've put together for your members as well. So please feel free to contact Chris and she can send that all on to you. Yep, it's been an absolute pleasure. Thank you so much for your time.
Sam, before you go, there are a couple of really nice questions up.
Sure.
Can I read them to you and then you can answer them while you're online? The first one is from Nicole, and she says, is the gap premium based on the oldest member on cover, even if they are a dependent?
No, a very, very good question, actually. So on Sanlam Gap only, it is based on the policy holder. So let's say, for example, husband and wife, and I'm going to make it your husband. Your husband's older than you are. You 59, your husband's 62. If you're the principal member of the gap, it will be your premium, the family premium will be under the age of 60. So we only take the policy holder of the gap cover's age into consideration. I hope that answers your question.
And then there was another question from Nicole also, can you cover 2 people on different medical aids?
Yes,
but not
absolutely.
the same, yeah?
Yep, sorry, Kerry, I just wanted to interrupt there. More than 2, actually. So husband, wife, or partner, child can be on separate medical aids, separate options, and they will be covered under one Sanlam Gap family policy.
Okay. And then the third question was, my scheme has a limit for MRI CT scans. Does the sub-limit enhancer assist when I exceed the scheme limit?
I think of the members on Bonitas. I actually did get this question from Bonitas. So yes, it would come out of the sub-limits benefit, but a portion would have to be covered obviously by the medical aid scheme. So if in this case, it would be, as long as the MRI or CT scan is that portion is covered from risk or major medical.
And then Shamila would like to say one last thing before
Thanks,
Gary closes off.
Thanks. Yeah, sorry, I failed to mention earlier that there's a 7% commission structure worked into the Sanlam EAP Evolve fees for the broker consultants. Thank you.
Thanks, Samantha. Thanks, Kerry. Thanks, Shamila. Hopefully, everyone found the session helpful. I think maybe I just want to land 1 or 2 points that, by way of closing, I think just to confirm that the Sanlam Staff Care product and the EAP product are compulsory products where we require the participating employer to fund the contributions towards those products. We understand there's situations perhaps where members will be on medical aid, so I think we're negotiable when we look at that. And similarly, there are situations where perhaps an employee would like to add some of their family members to the 20 Rand product. Again, that's something that we would be prepared to look at and understand, as long as that is still remains a payroll deduction from the employer. So, and on the Gap side, it's a member specific option, and it's not a compulsory option funded by the medical, is funded by the employer. I think the second point, many of you on the call may be health accredited or short-term accredited, which is a requirement obviously to give advice on the Gap product. Both the EAP and the staff care product, you don't require any form of phase accreditation to give advice or discuss that product. However, we're also appreciative that some of these concepts are medical concepts, and not everyone on the call will have the necessary background or training to feel comfortable delivering presentations through to your clients. So we're more than happy to, we expect to have requests from you to join you and to help you present these options through to your clients. If you'd like to take us up on that offer, then I think best to work through the Sanlam Client Solution team who support you, or alternatively, the client relationship managers within the SUF and SGR environments that also might support you directly with your clients. Failing that, I think in some of the marketing material we'll leave with you, we'll have direct contact information for Samantha's team, Kerry's team, and Dr. Shamila's team. So thank you very much again for your time and your interest. We've had lots of people on the call, and lots of people have stayed on the call for the duration. I think that's a good sign that hopefully we've presented something that you think will be of value to your clients and to yourselves and your businesses.
Yes.
So with that, I'd like to end the call.
Thank you. Thank you.
Thanks, everyone.